Hello, I'm Sheila Davies, Director of the Dare County Department of Health and Human Services. I will begin today's update with a review of our recent positive cases. The number of positive COVID-19 tests in Dare County is 60, 12 of which are considered active, with one individual remaining hospitalized and the other 11 in home isolation in Dare County. Of the 60 cases, 29 are residents and 31 are non-residents. Since the last Dare County Department of Health and Human Services update, issued Friday, June 19th, there have been 16 new positive cases. Of these 16 cases, 2 are residents and 14 are non-residents. The Dare County website has already been updated to reflect all of these cases. The 2 resident cases are not connected. They are both symptomatic and recovering in home isolation. It is believed these individuals acquired the virus through community spread, as neither individual is aware how they contracted the virus. Of the 14 non-resident cases, 5 are household contacts, 2 are symptomatic and 3 are asymptomatic, who acquired the virus by direct contact with another non-resident household member whose positive test was reported on 6/18. 2 are siblings, both symptomatic, and acquired the virus by direct contact with a positive case outside of Dare County. 3 others are all symptomatic and acquired the virus through direct contact with individuals who tested positive outside of Dare County. None of these cases, however, are connected. All 10 of these cases have been transferred to their home counties and are in isolation in those counties. The remaining 4 of the 14 non-resident cases share a household. 2 individuals are symptomatic and 2 are asymptomatic. It is believed one of the individuals in the household acquired the virus through community spread or travel and then passed the virus to the other 3 household members. These individuals are in home isolation in Dare County. We are seeing a number of vacationers go to the area urgent care centers for COVID-19 testing while in Dare County because either they are symptomatic or they have been contacted by someone from back home who informed them that they were a direct contact to a positive case. When they are tested, they immediately become classified as a PUI, or person under investigation, and must quarantine for at least 14 days. If the result comes back positive, then we notify and inform them of their specific duration for their isolation period. We cannot force them to leave Dare County. Some choose to leave and some choose to stay. We call them every day while they remain in Dare County to check in on them, and when they go home, we transfer their case to their home health department to finish out their isolation monitoring. The day we call them to give them their positive test result, we also immediately start work on contact tracing, which includes everyone in their house at the present time, as well as any other contacts they may have had while in Dare County prior to testing or onset of symptoms. All direct contacts are notified they are to quarantine for 14 days and encouraged to get testing. Right away, if they have symptoms, or if they are asymptomatic, they are asked to wait 6 days from their first day of exposure to be sure they don't get a false negative. Being in the same grocery store or at the same gas station as an individual who tests positive does not make you a direct contact. Being 6 feet or closer for 10 minutes or greater to an individual who tests positive makes you a direct contact. Since there are asymptomatic carriers of the virus, we must all practice the 3 W's: wear, wait, and wash to protect ourselves and our families. A total of 357 appointments have been booked for the COVID-19 antibody and diagnostic testing event on Tuesday, June 30th, 2020 in Kill Devil Hills. Currently, there are no appointments available for antibody testing. There are still diagnostic drive-through testing appointments available. To schedule an appointment, please call 252-475-5008. The call center is open Monday through Friday from 8:30 a.m. to 5 p.m. For more information on testing, please visit darenc.com/COVID testing. We will announce details about a second antibody testing clinic by Wednesday, July 1st. Dare County Department of Health and Human Services monitors and evaluates 4 key metrics associated with disease investigation and surveillance. The metrics are number of tests, confirmed cases, positive test as a % of total test, and COVID-like illness surveillance. This past week had the highest number of COVID-19 diagnostic tests performed by healthcare providers in Dare County at 323 tests. This brings the total number of tests performed since early March to 1,991. We had 14 positive cases between June 15th and June 21st. The percent of positive tests to overall tests in Dare County since we started testing in early March increased slightly this week to 2.46%. The percent positive to total tests for the past week alone was 4.33%. The syndromic surveillance of individuals who presented to the emergency department with COVID-19-like symptoms last week remained low. These graphs can be found on the Dare County website at darenc.com/COVID-19. Please do your part to slow the spread of the virus by following the 3 W's: wear, wait, and wash. Wear a cloth face covering if you will be with other people. Wait 6 feet apart and avoid close contact, and wash your hands often with soap and water for at least 20 seconds or use hand sanitizer. While there is now a mandate in Dare County where individuals must wear a face covering when social distancing cannot be maintained, there are individuals who have legitimate medical reasons and are not able to wear a face covering. We all need to be kind, show compassion, and understanding. We encourage you to stay informed by visiting darenc.com/COVID-19 or by visiting the CDC or NCDHHS websites. If you have specific needs or questions, you may also call the Dare County COVID-19 Call Center, open Monday through Friday from 8:30 a.m. to 5 p.m. at 252-475-5008. Thank you.